Hello, my name is Jacob Carson, and this is my project, The Rise of Electronic Health Records. George Mason University, IT 104, Section A02, June 9th, 2017. The research paper discusses topics in 6 different areas: the background, potential benefits, legal and ethical issues, security concerns, social problems, and research needed. The first electronic health record systems began being created in the 1960s by academic medical centers. These systems were created to compile all patient data and physician treatment notes. In the 1980s, the healthcare industry began developing standards. The process accelerated as computers continued to get smaller and more accessible. In the 1990s and the 2000s, large private and nonprofit health systems, large hospitals, began adopting EHR systems. This was around the same time that the Health Insurance Portability and Accountability Act was passed and defined a lot of what was considered electronic health records. Today, a lot of legislation is now in effect that promotes the use of EHR systems by medical providers. The American Recovery and Reinvestment Act of 2009 is a key resource in pushing providers to convert to electronic systems and providing financial incentives to do so. What are the potential benefits of an electronic health record system? Well, the primary benefit is easy access to medical records from anywhere at any time. Patients would be able to look up their records from a simple cell phone or laptop computer. Physicians could travel anywhere around the world and still be able to get access to their patients' medical records in the event of an emergency. Another major improvement is the accuracy of clinical data and the review of treatment plans. By being able to track all of the information about a patient's treatment electronically, a physician can review and create calendar notices that signal when it's time for the next step of a patient's treatment. It can create alerts for staff to contact the patient. And in addition, performing oversight is much easier when another physician can easily access that clinical data and treatment plan. Another improvement is the speed and coordination of lab work and prescriptions. Today, about 70% of prescriptions are sent electronically directly to the pharmacy. No more writing out scripts and having to get them filled by hand. In addition, lab work results can be received back and forth from the lab electronically. And finally, increased efficiency in submitting claims for payment with required documents. Oftentimes, insurance companies will need to see copies of medical records in order to pay for the services that were provided to the patient. Electronic health records make it much simpler to put together the comprehensive data needed for insurance plans. The primary legal and ethical issues related to electronic health record systems include the privacy of medical records, patient access to physician treatment notes, drafting business associate agreements, the legislative and regulatory support for these initiatives, and penalties for non-adoption of electronic health record systems by providers. Security is one of the chief areas of concern for electronic health record systems. There's been a large increase in cyber activity all around the country with ransomware attacks on hospitals and physician groups. Much of this happens because of a lack of provider and patient training on how to identify potential phishing attacks. This can have a great impact on patient safety, as ransomware attacks can potentially shut down hospitals and impact patient care. A lot of this happens because many hospitals and physician groups have not really had much of a security infrastructure in the past. Most of the resources were usually put into medical treatment resources and not IT. So now Many hospitals are relying on consulting firms to fill in the gaps and provide expertise on IT security issues. Unfortunately, many of these threats are quickly evolving, and hackers are making changes every day to evade detection. Some of the social problems that are seen with electronic health record systems mainly begin with charts being replaced by these new computers, tablets, and phones. Oftentimes, providers have a lack of familiarity with these devices. This leads to a lack of adequate communication with patients and moving away from in-person interactions. Also, the industry has seen an increased emphasis on telemedicine, where the patient is physically removed from the provider and instead treatment is given over the phone or webcam. Oftentimes, this decreases overall patient satisfaction with their care. Additional research is still needed in the EHR systems, showing what kind of overall value these systems might bring a medical provider, as they're very costly and difficult to maintain. There's also some initial research that shows great potential for improving care and efficiency, but they still need to be explored in additional detail. More research should also be needed to understand whether hospital or physician groups will be able to protect their patient data against these cybersecurity threats. Finally, we need additional research on how these devices impact patient satisfaction. Are they too distracting to providers? In conclusion, EHR systems are the future and won't be going away anytime soon. So medical providers need to invest in additional IT security resources so they can protect patient data. These medical providers must also train staff to use these new medical devices while treating patients, while still providing the same exceptional levels of care they were previously. And that finally, this threat will always be changing and never completely resolved. Also, please find this list of attached references that were used in developing my research paper. Please note that the PowerPoint template used in this video was created using a template purchased and licensed through graphicriver.net.